Hello everyone, welcome to HIM 216. This is a continuation of the lectures covering Chapter 6 in your textbook. If you will, turn to page 113, and in this lecture we're actually going to finish up through up to the point of the guidelines. Now, body part is discussed on the bottom of page 113. The body part character is the fourth character on the code. It identifies the body part on which the procedure is being performed. And in your book, it tells you that each body system will have its corresponding body parts. And so, for instance, if we go and look at the heart and great vessels. And let's see, we're going to do we'll just choose excision. You can see that the body parts are all specific to the heart and great vessels. Whereas if I chose the gastrointestinal system, the body part is going to be specific to the structures in the gastrointestinal system. So they're very specific. If a procedure is performed on a portion of a body part that doesn't have its own body part value, then you're going to code the body part value that corresponds to the whole body part. For instance, if the prefix peri is used, like as in perirenal, you're going to choose the kidney body part. Now, if there's a branch of a body part that doesn't have its own body part, then you code it to the closest proximal branch of that specific body part value. And if an identical procedure is performed on bilateral body parts and there's no bilateral body part value, then you code each of them separately based on right and left. And I want to show you something here. Well, one of the first things that I want to make sure that we look at is when you are going into the integrated code book, you must choose this book with a 10 on it. ICD-10 actually went into effect October 15th of last year. I know that in chapter 1 of your book it says that we're using ICD-10 went into effect October 1 of last year. Your book said we were using I9, but we're not. That's why you're studying ICD-10, is because ICD-10 is the official coding and classification system. You have to click on this 10 book right here. If you click on this DX, you're going to be in I9. You see when I hover over it, it says I9. When I hover over the 10, it says ICD-10. Choose ICD-10, otherwise you're going to have the wrong codes on your homework assignments. So now in the procedural coding system, of course, which is where we're coding all procedures, I want to point out to you that if you click on this little question mark, it's going to give you definitions of these different body parts, and it tells you, see, the upper esophagus includes the cervical esophagus. The pylorus of the stomach includes the pyloric antrum, canal, sphincter. So definitely you may find it very helpful if you can't find your body part listed and you want to make sure that you're in the right body system. Click on that question mark and see if you can find your body part there. The other thing that I want to point out to you is that if I click on Help and I go to PCS for Procedural Coding System, I have the guidelines here on the reference manual. I have a body part key. If I click on that body part key, it opens up and it shows me different body parts. So, for instance, abdominal esophagus, I would use the body part of esophagus lower. Accessory spleen, I would use the body part of spleen. For the Achilles tendon, there is no body part for Achilles tendon. There's no body part for any of these. I would use the body part of lower leg tendon right or lower leg tendon left. So you may also find this body part key to be very helpful, and it's very comprehensive. So if I go back into procedures, choose medical surgical, go into gastrointestinal, go into excision, which is the root operation for a biopsy. You can see I have esophagus upper, middle, and lower. So if I clicked on body part, if I say upper esophagus, if the term is cervical esophagus, I know I'm going to use upper as my body part, and so on and so forth. So also looking on page 114, we want to talk about approaches. And the approach is the fifth character. This is the approach right here. So character 5, I'm just going to go ahead and choose a body part. So character 5 out of 7. And there's a specific definition for each approach. But keep in mind that physicians are not required to use this terminology, and they very often will not. As a coder, you're required to be able to review the operative report and determine what the approach is. There are 7 approaches. Here in gastrointestinal for excision, we have 6 of them. The one that we don't see listed here is F. But I want to show you that if I click on this question mark for approach, I have the definitions here. So this may also be very helpful to you when you are coding. It's a quick, easy reference for an approach. So let's talk about the definition for these approaches. The first one we're going to talk about is open. What is an open approach? An open approach is when they cut through the skin, the subcutaneous tissue, the fascia, the peritoneum, any body parts that they need to visualize or expose the site for the procedure. And on page 115, if you look at A, that's what they have done here. And you can see that they have retractors holding that wound open so that they can get in there and see what they're doing and perform their procedure. Now, the root operation of percutaneous, which corresponds to the number 3, is when they either puncture or just make a minor incision and put instrumentation through the skin or any other body part layers to reach the site of that procedure. And the classic example of that is a percutaneous needle biopsy. If you look at B, this is an example, and they can do a percutaneous biopsy of the liver, the pancreas, the spleen. So they don't visualize it. It's just like a shot in the dark, and they know where those structures are. They can palpate them, and they can perform a percutaneous biopsy. They get tissue, they send it off to the pathologist to have them look at it. And it looks like a big needle. They stick it in there and suck tissue out and then pull it out. Now, percutaneous endoscopic, C on page 115 is percutaneous endoscopic, and this is an example of it still is the definition of percutaneous, but they use instrumentation to help them visualize the site of that procedure. And the example they have is a laparoscopic cholecystectomy. And so they have to make incisions into the skin to get the instrumentation in so they can visualize that particular structure. Now 7 is via natural or artificial opening. So if you look at D on page 115, the example of this is like putting in endotracheal intubation. They put instrumentation in through a natural artificial opening to reach the site of the procedure. And then 8 if you look at E on page 115, via natural or artificial opening endoscopic, and this is an example of a colonoscopy. They use instrumentation through a natural opening to visualize the site of a procedure. And they can do the same thing with the lungs and with the upper GI system. They can actually go in and endoscopically examine those by going in through the mouth. Now, if you look at F on page 115, this corresponds to the procedure F on page 116. Again, this is via a natural or artificial opening with percutaneous endoscopic assistance. So we have percutaneous and we have percutaneous endoscopic, but this is through a natural or artificial opening with percutaneous endoscopic assistance. So 8 is via natural or artificial opening endoscopic. F is via natural or artificial opening endoscopic, but it's with percutaneous endoscopic assistance. And I know that is confusing. But the difference between 3 and 4 and 8 and 9 is the fact that there is a natural opening into the body, say the mouth and the esophagus or the colon, versus them just popping a needle into the belly to extract tissue. And then our final root operation is X for external. And external is when the procedure is performed on the skin, directly on the skin, or pressure is applied. And examples of this, so for instance, you have a mole and you have it frozen off. That is external. You have a cut on your arm and they suture it. That is external. External also refers to structures that can be visualized through openings. So a tonsillectomy is actually an external approach. Also, another thing that's external is if you have a fracture that has a manual reduction, they accomplish that by applying pressure to that bone through the skin, and it moves that bone back into alignment. They didn't cut open the skin. They didn't do an open reduction. They did a closed reduction. They manipulated that bone to get it back into alignment, and that is also considered an external approach. Okay. Robotic assisted surgery. Now, we've had huge advancements in computer technology, and they now have computer assisted surgery. I'm familiar with, I've heard the ads that Spartanburg Regional has made about their robotic assisted surgery. I know that we might have had a little blip in the recording there. I apologize. At Spartanburg Regional, they do robotic assisted surgeries. I know that they do some robotically assisted joint replacements, hysterectomies, that type of thing. When computer-assisted surgery is a part of the procedure, there is an adjunct procedure. There's an additional procedure code that you use in addition to the actual code for the procedure that is being performed. Robotic assisted surgery is minimally invasive. And your book kind of describes how those are performed. And if we were going to look at the procedure codes for this, we would be actually going into other procedures, and we would be choosing physiological systems and anatomic region, and then other procedures. And you can see that for method, in method we would choose computer assisted procedure or robotic assisted procedure. And you can see that the body regions are pretty much each of the body regions is listed here. And then of course we have an approach, and we would determine that from the actual procedure. In your textbook, they describe a robotic assisted laparoscopic radical prostatectomy. That includes the seminal vesicles and also a diagnostic pelvic lymphadenectomy. And the robotic code that is applicable in this one, the trunk region is the body region that would be applicable when we're looking at this procedure. And then it's percutaneous endoscopic. It tells us that this was a laparoscopic radical prostatectomy, and that's percutaneous endoscopic. And then once we choose trunk region, and we choose percutaneous endoscopic, our only method is robotic assisted procedure. And we'll talk about qualifiers in a minute, but there's no qualifier. We do not have the option. You can see this is a perfect example of seeing how the tables gray out the codes that would not be applicable. And we can look at the different approaches for trunk region to see how it affects the method. Sometimes it's just kind of interesting to play around with them and see how it impacts the remainder of the codes that you can choose. Now, while this lecture is not over, your question for this lecture is exercise 6.5. I want you to answer question 1 and question 3. And when you answer those questions, just include the letter that corresponds to the approach, and you don't have to type out the entire approach. Now I would like for you to turn to page 118 in your book, and we're going to talk about devices. Device is the 6th character, and the very important thing that you have to remember about this is that this identifies a character that remains after the procedure is completed. And there are 4 types of devices. There are devices that are materials that take the place of all or a portion of a body part. Devices that assist or prevent a physiological function. There is material that's not absorbed by, eliminated by, or incorporated into a body part. And then there are mechanical or electronic appliances that assist, monitor, or take the place of or prevent a physiological function. And the root operations are very specific. There are root operations that you only use when you have a device. And those are change, insertion, removal, replacement, revision, and supplement. They always have to involve a device. But it's important to know that if materials are a part of a procedure, such as clips or ligatures or sutures, those are not considered a device. Look at figure 6.8. And there is a value for other device and that is the letter Y. And it can be used until more specific devices are added by ICD-10. And we're going to have some major updates to ICD-10 this fall. There has been a moratorium on changing any codes, and I suspect that this fall we will see significant changes to these devices. Exercise 6-8. I want you to answer questions 1 and 3. So exercise 6-5, you're doing 1 and 3. Exercise 6-6, I'm sorry if I said 6-8, I meant 6-6. 6-6, we're doing 1 and 3. Now let's quickly talk about qualifiers. And the qualifier is the 7th character in the code. So it is that very final character in the code, the qualifier. Let me get out of here and go back into medical surgical. And let me choose gastrointestinal excision. And you can see actually and many times there's no device, and many times there is no qualifier. So the qualifier actually is a unique value for an individual procedure. It can indicate that a qualifier was done for diagnostic purposes. You see this X? So let's say that it was a biopsy of the colon, and it was diagnostic, and it determined that the patient had colon cancer, and then they came back and had a colon resection. That colon biopsy would have a qualifier of X for diagnostic. But when they did the colon resection, there would be no qualifier, because that is not a diagnostic procedure, it's a definitive procedure. So when you have procedures that are done for diagnostic reasons, they want a diagnosis. They have a specimen, they're sending it for a path report. They'll make a decision about a definitive procedure once they get those biopsy results back. That's the difference in diagnostic and no qualifier. The qualifier can have other definitions as well. If we go in and look at heart and great vessels, let me choose bypass. The qualifier basically is the vessel that is the origin of the bypass, and we'll look at this in more detail when we go over the guidelines and look at some different examples. You can see devices here. These devices actually refer, when we're talking about a bypass, these devices actually refer to the bypass material. So that's going to conclude this lecture for Chapter 6. And in our next lectures, we're actually going to be going over the guidelines.